Now, we're going to go inside of the South African change room. Bowlers and batsmen, fielders, everybody gets injured, unfortunately. Now, Dr. Mohamed Musaji and his team want the South Africans to recover quicker than usual. Let's have a look at the machine that they've got in that change room.
As the Proteas go into another hectic season of playing international cricket, they are heading into a test series now. Straight after this, they're heading into an ODI series and into T20s. This has got a lot of strain in players, on their bodies, and in their capacity as players producing results so often. We have now started to use a new piece of technology that is called lower body negative pressure, VacuSport. The principle of lower body negative pressure and VacuSport lies in space medicine. No astronaut can go into a weightless atmosphere without lower body negative pressure. On Earth, gravity assists your blood into your lower extremities. Up in space, where all the blood accumulates into your upper extremities, there's no gravity to assist the blood flow to your legs and your lower extremities. Space medicine is now coming to the Proteas change rooms to assist against burnout and player fatigue, and also help with the recovery stages and also with injuries. Lower body negative pressure is obviously a supply of fresh blood to the lower extremities. Players recover much faster, and also the recovery time between injuries is much faster. The VacuSport works in two different phases, in a negative pressure phase and an atmospheric pressure phase. Well, you might ask why cricketers is using a machine that is normally used by patients that suffer from vascular diseases or poor blood supply like diabetic patients to the lower extremities. The reason is that the machine circulates fresh blood and replaces old blood with fresh blood into the lower extremities. This has got massive healing capabilities and also the removal of lactic acids. As a player comes off the field, a player like Dale Steyn might have bowled 10-15 overs during the day. The patient would then basically go into the chamber, and that player would then get fresh supply of oxygenated blood into the lower extremities. The VacuSport has got 8 preset programs ranging from lactic acid removal up to treatment of fractures in the players' lower bodies. The technology is pre-programmed, so it's got the best program for a specific injury or treatment. The players would basically slide into this iris with their feet first. As soon as the player is in the his lower body is in the chamber, he gets sealed off, airtight, and as soon as we apply pressure to the machine, you can see that all the air is taken out of the chamber. This decompresses the chamber, and in that stage, that is where your capillaries start dilating. Once you apply pressure, more oxygen, fresh blood can be fed through those specific capillaries. Capillarization also starts to form. That means new capillaries into the lower body, more oxygen enriched blood to the broken down areas, and that is the healing capability of the lower body.